Understanding and mitigating stroke risk factors, a comprehensive overview. A stroke occurs when blood flow to the brain is disrupted, leading to damage or death of brain cells. While strokes can happen suddenly, there are several identifiable risk factors that contribute to their occurrence. Recognizing and addressing these risk factors is crucial for preventing strokes and promoting overall cardiovascular health. Lifestyle risk factors. Lifestyle choices play a significant role in determining an individual's risk of experiencing a stroke. Smoking, for instance, is a well-established risk factor. Cigarette smoke contains chemicals that can damage blood vessels, increase blood pressure, and contribute to the formation of blood clots. Smoking cessation is a critical step in reducing stroke risk and improving overall cardiovascular health. Another lifestyle factor is an unhealthy diet high in saturated and trans fats, cholesterol, and sodium. Poor dietary choices can lead to conditions such as obesity, high blood pressure, and diabetes, all of which are independent risk factors for stroke. Adopting a diet rich in fruits, vegetables, whole grains, and lean proteins can contribute to better cardiovascular health and reduce the risk of stroke. Additionally, physical inactivity is a risk factor for stroke. Regular exercise helps maintain a healthy weight, regulate blood pressure, and improve overall cardiovascular function. Individuals are encouraged to engage in at least 150 minutes of moderate-intensity aerobic exercise per week to promote heart health and reduce stroke risk. Medical risk factors. Several medical conditions contribute to an increased risk of stroke. Hypertension or high blood pressure is a leading cause. Persistent elevated blood pressure can damage blood vessels and make them more susceptible to rupture or blockage. Regular monitoring of blood pressure and appropriate management through lifestyle changes and medications are essential in preventing strokes. Diabetes is another significant medical risk factor. Individuals with diabetes have an increased likelihood of developing atherosclerosis, a condition where arteries become narrowed and hardened due to the buildup of plaque. This can lead to both ischemic and hemorrhagic strokes. Proper management of diabetes through medication, diet, and lifestyle modifications is crucial in reducing stroke risk. Heart conditions, such as atrial fibrillation, can also contribute to strokes. Atrial fibrillation can lead to the formation of blood clots in the heart, which can then travel to the brain and cause a stroke. Managing heart conditions through medication and, in some cases, procedures like anticoagulant therapy is vital for stroke prevention. Genetic and demographic risk factors. Genetic factors can also influence an individual's predisposition to strokes. Family history of stroke or certain genetic conditions may increase the likelihood of experiencing a stroke. While these factors cannot be modified, awareness of genetic risk can prompt individuals to be more vigilant about lifestyle choices and regular health checkups. Age and gender are demographic factors that play a role in stroke risk. The risk of stroke increases with age, with the majority of strokes occurring in individuals over 65. Men generally have a higher risk of stroke than premenopausal women. However, the risk equalizes in the postmenopausal period. Awareness of these demographic factors can guide healthcare professionals in tailoring prevention strategies based on an individual's unique risk profile. Understanding and addressing the various risk factors for stroke is essential for effective prevention. Lifestyle modifications, management of medical conditions, and awareness of genetic and demographic factors collectively contribute to a comprehensive approach to stroke prevention. By adopting a proactive and personalized strategy, individuals can significantly reduce their risk of experiencing a stroke and promote long-term cardiovascular health. Types of strokes. Understanding the varieties of cerebrovascular incidents. A stroke, or cerebrovascular accident, is a medical emergency that occurs when blood flow to the brain is disrupted, leading to damage or death of brain cells. There are different types of strokes, each with distinct causes, symptoms, and implications for treatment. Understanding these variations is crucial for both medical professionals and the general public. Ischemic stroke. Ischemic strokes are the most common type, accounting for approximately 87% of all strokes. These occur when a blood vessel supplying the brain becomes blocked or narrowed, restricting blood flow. The blockage can stem from a blood clot that forms within the blood vessels of the brain, thrombus, or one that travels from another part of the body to the brain, embolus. The lack of blood flow deprives brain cells of oxygen and nutrients, leading to cell damage or death. Treatment for ischemic strokes often involves the administration of clot-busting medications such as tissue plasminogen activator, TPA, or mechanical thrombectomy, a procedure to remove the clot. Timely intervention is critical to minimize brain damage. Hemorrhagic stroke. Hemorrhagic strokes, while less common than ischemic strokes, are often more severe and have a higher mortality rate. These strokes occur when a blood vessel in the brain ruptures, leading to bleeding in or around the brain tissue. The two main types of hemorrhagic strokes are intracerebral hemorrhage, where bleeding occurs within the brain tissue, and subarachnoid hemorrhage, where bleeding occurs in the space between the brain and the surrounding membrane. Management of hemorrhagic strokes involves controlling bleeding and reducing pressure on the brain. This may require surgery to repair the ruptured blood vessel or remove blood clots. Blood pressure management is also crucial in preventing further bleeding. Transient ischemic attack, TIA, often referred to as a mini-stroke. A transient ischemic attack is a temporary disruption of blood flow to the brain. Unlike a full-blown stroke, TIAs do not typically cause permanent damage. However, they serve as a warning sign that an individual is at increased risk of a more severe stroke in the future. TIAs share similar symptoms with strokes, such as sudden weakness, numbness, or difficulty speaking. While the symptoms may resolve within a short period, it is essential to treat TIAs seriously. Medical evaluation is necessary to identify and address the underlying causes, such as atherosclerosis or blood clots, to prevent a more severe stroke. Understanding the types of strokes is vital for effective prevention, timely intervention, and appropriate management. Ischemic strokes, hemorrhagic strokes, and transient ischemic attacks each present unique challenges, necessitating tailored approaches to treatment and rehabilitation. Public awareness of stroke types and symptoms is crucial for promoting a proactive approach to stroke prevention and response. Recognizing the signs. Understanding stroke symptoms and warning signs. A stroke is a medical emergency that requires prompt attention and intervention. The key to minimizing the impact of a stroke lies in recognizing the symptoms and warning signs early. Understanding the manifestations of a stroke can empower individuals to seek immediate medical assistance, significantly improving the chances of a positive outcome. Common symptoms of stroke. The symptoms of a stroke can vary depending on the type of stroke and the area of the brain affected. However, there are common signs that individuals and those around them should be aware of. These can be remembered with the acronym FAST. Face drooping, sudden drooping or numbness on one side of the face is a classic sign of a stroke. Ask the person to smile, and if one side of their face appears uneven or droops, it may indicate a stroke. Arm weakness. Weakness or numbness in one arm is another common symptom. When asked to raise both arms, if one arm drifts downward or is unable to be raised, it may suggest a stroke. Speech difficulty. Slurred speech or difficulty speaking coherently is a significant indicator of a stroke. If the person has trouble repeating a simple sentence or expressing themselves, urgent medical attention is needed. Time to call for help. Time is crucial in stroke care. If any of these symptoms are observed, it is essential to call emergency services immediately. Rapid response can lead to timely intervention and better outcomes. Additional stroke symptoms. Beyond the FAST acronym, there are other symptoms that may indicate a stroke is occurring. These include sudden, severe headache. A sudden and severe headache, especially if it is accompanied by other symptoms such as dizziness or changes in vision, may signal a hemorrhagic stroke. Vision changes. Sudden changes in vision, such as blurred or double vision, or sudden difficulty seeing out of one or both eyes, can be indicative of a stroke affecting the visual centers of the brain. Confusion or trouble understanding. Cognitive symptoms such as confusion, difficulty understanding speech, or trouble comprehending written language may also occur during a stroke. Loss of balance or coordination. A sudden loss of balance, dizziness, or difficulty walking can be a sign of a stroke affecting the cerebellum or brainstem. It's important to note that not all individuals will experience all these symptoms, and symptoms may vary in intensity. The key is to be vigilant and responsive to any sudden changes in health. The importance of timely response. Time is of the essence when it comes to stroke care. The longer blood flow is disrupted to the brain, the greater the potential for permanent damage. Immediate medical attention can help minimize the impact of a stroke and improve the chances of recovery. Emergency medical services should be activated at the first sign of a stroke. Paramedics can begin crucial assessments and provide necessary information to the receiving hospital, ensuring that the appropriate resources and specialists are ready upon the patient's arrival. In the hospital, diagnostic tests such as CT scans and MRIs will be performed to determine the type and location of the stroke. For ischemic strokes, clot-busting medications like tissue plasminogen activator, TPA, may be administered if the patient arrives within the critical time window. Understanding stroke symptoms and warning signs is paramount for timely intervention and improved outcomes. Public awareness campaigns, education, and community training can contribute to a proactive approach in recognizing and responding to strokes, ultimately saving lives and reducing the long-term impact of this medical emergency. Empowering health. Comprehensive stroke prevention strategies. Stroke prevention is a critical aspect of healthcare, given the potentially severe consequences of cerebrovascular events. While strokes can be sudden and unpredictable, there are proactive measures individuals can take to significantly reduce their risk. Adopting a multifaceted approach that encompasses lifestyle modifications, medical interventions, and awareness of risk factors is key to effective stroke prevention. Lifestyle modifications. Lifestyle choices have a profound impact on overall health and play a central role in stroke prevention. One of the most influential lifestyle factors is maintaining a heart-healthy diet. A diet rich in fruits, vegetables, whole grains, and lean proteins, while low in saturated and trans fats, cholesterol, and sodium, can contribute to optimal cardiovascular health. Such a diet helps manage weight, control blood pressure, and regulate cholesterol levels, all of which are critical in reducing stroke risk. Regular physical activity is another cornerstone of stroke prevention. Engaging in moderate-intensity aerobic exercise for at least 150 minutes per week promotes cardiovascular fitness, helps control weight, and contributes to overall well-being. Exercise also supports healthy blood vessels and can lower the risk of conditions like hypertension and diabetes, both of which are significant stroke risk factors. Smoking cessation is paramount in stroke prevention. Smoking damages blood vessels, increases the likelihood of blood clots, and raises blood pressure. Quitting smoking has immediate and long-term benefits, substantially reducing the risk of stroke and improving overall cardiovascular health. Moderate alcohol consumption is generally considered acceptable and may even have some cardiovascular benefits. However, excessive alcohol intake can contribute to hypertension and increase the risk of stroke. Individuals are advised to limit alcohol consumption to moderate levels, defined as up to 1 drink per day for women and up to 2 drinks per day for men. Medical interventions. Managing and treating medical conditions that are known risk factors for stroke is a crucial aspect of prevention. High blood pressure or hypertension is the single most significant modifiable risk factor for stroke. Regular monitoring of blood pressure, lifestyle modifications, and appropriate medication adherence are essential in controlling hypertension and reducing stroke risk. Diabetes is another important risk factor, and its effective management is integral to stroke prevention. Individuals with diabetes should work closely with healthcare professionals to maintain optimal blood sugar levels through medication, diet, and lifestyle modifications. Atrial fibrillation, a heart rhythm disorder, can lead to the formation of blood clots that may travel to the brain, causing a stroke. Management of atrial fibrillation through medications and, in some cases, anticoagulant therapy is essential in preventing stroke in individuals with this condition. Cholesterol levels should be regularly monitored, and interventions such as statin medications may be prescribed to manage high cholesterol. Controlling cholesterol levels is critical in preventing the buildup of plaque in the arteries, reducing the risk of atherosclerosis, and subsequently lowering the risk of stroke. Awareness and early intervention. Early recognition of stroke symptoms and prompt response are integral to preventing severe outcomes. Public awareness campaigns and education efforts play a vital role in empowering individuals to recognize the signs of a stroke. Remember the importance of acting quickly and seek immediate medical attention. Routine health checkups and screenings can help identify and address risk factors before they lead to a stroke. Regular checkups allow healthcare professionals to monitor blood pressure, cholesterol levels, and other key indicators, facilitating timely intervention and preventive measures. Additionally, genetic and familial risk factors should be considered. Individuals with a family history of stroke or specific genetic conditions may be at increased risk and should work closely with healthcare providers to develop personalized prevention strategies. Finally, vaccination against certain conditions, such as influenza and pneumonia, can contribute to overall health and indirectly reduce stroke risk. Infections and their complications can stress the cardiovascular system, potentially increasing the risk of stroke in susceptible individuals. Stroke prevention is a multifaceted endeavor that requires a combination of lifestyle modifications, medical interventions, and awareness of individual risk factors. A proactive approach to health supported by regular checkups and a commitment to a heart-healthy lifestyle can significantly reduce the risk of stroke and promote overall well-being. By embracing these prevention strategies, individuals can empower themselves to take control of their health and reduce the impact of stroke on their lives. Nurturing hope, a comprehensive look at stroke rehabilitation and recovery. Stroke rehabilitation is a crucial phase in the journey toward recovery after a cerebrovascular event. The aftermath of a stroke often presents challenges, but with comprehensive rehabilitation efforts, individuals can regain lost abilities, enhance their quality of life, and strive towards a more independent and fulfilling future. The rehabilitation process. Stroke rehabilitation typically begins soon after the acute phase of the stroke, when the patient's medical condition has stabilized. The primary goals of rehabilitation are to help individuals regain as much independence as possible and adapt to any persistent disabilities. The rehabilitation team, which may include physiatrists, physical therapists, occupational therapists, speech-language pathologists, and other healthcare professionals, collaborates to create an individualized rehabilitation plan tailored to the specific needs and abilities of the patient. Physical rehabilitation. Physical therapy is a cornerstone of stroke rehabilitation, focusing on rebuilding strength, balance, and coordination. Therapists work with patients to improve mobility and reduce the risk of falls. Exercises may include activities to enhance muscle strength, joint flexibility, and gait training. Assistive devices such as canes or walkers may be introduced to support mobility. Occupational rehabilitation. Occupational therapy aims to help individuals regain the skills needed for daily living activities. This includes tasks such as dressing, grooming, cooking, and bathing. Therapists collaborate with patients to develop strategies and adaptive techniques, making it possible for individuals to perform these activities independently or with minimal assistance. Speech and language rehabilitation. Stroke survivors who experience difficulty with speech and language often benefit from speech therapy. Therapists work on improving communication skills, including speaking, understanding language, reading, and writing. In cases where swallowing is affected, therapists assist in developing safe swallowing techniques to prevent complications like aspiration. Cognitive rehabilitation. Cognitive rehabilitation addresses deficits in cognitive functions such as memory, attention, and problem-solving. Therapists employ various exercises and strategies to enhance cognitive skills, promoting better mental functioning and overall independence. Challenges in stroke rehabilitation. Stroke rehabilitation is a dynamic and sometimes challenging process, with progress varying from person to person. Several factors influence the rehabilitation journey. Time and patience. Recovery after a stroke is often a gradual process that requires time and patience. The extent and pace of recovery can be influenced by factors such as the severity of the stroke, the individual's overall health, and the presence of pre-existing conditions. Setting realistic expectations and celebrating small victories are essential aspects of the rehabilitation mindset. Individualized approach. Every stroke is unique, and so is the recovery journey. Rehabilitation programs must be tailored to the specific needs, goals, and abilities of each individual. What works for one person may not be suitable for another, emphasizing the importance of a personalized approach to care. Emotional and psychological impact. The emotional toll of a stroke can be profound, affecting both the individual and their loved ones. Depression, anxiety, and a sense of loss are not uncommon. Recognizing and addressing these emotional challenges is integral to holistic stroke rehabilitation. Mental health support, counseling, and group therapy can be valuable components of the recovery process. Life after stroke. Strategies for long-term recovery. Beyond the structured rehabilitation period, individuals continue to face challenges and opportunities for growth. Long-term recovery involves ongoing strategies to maintain and further improve function, independence, and quality of life. Continued rehabilitation exercises to maintain and enhance gains made during formal rehabilitation. Individuals are often encouraged to continue specific exercises and activities at home. These may include stretching, strength training, and functional tasks relevant to daily life. Community engagement and support. Social support is a vital aspect of long-term recovery. Community-based programs, support groups, and social activities can provide not only companionship but also opportunities to share experiences and strategies for overcoming challenges. Adaptive strategies and assistive devices. Implementing adaptive strategies and using assistive devices can facilitate independence in daily life. This might include modifications to the home environment, the use of mobility aids, or the integration of technology to enhance communication or cognitive function. Ongoing medical management. Regular medical checkups are essential to monitor overall health and manage any ongoing medical conditions. Medication management, especially for conditions like hypertension or diabetes, remains a critical component of long-term stroke care. Stroke rehabilitation is a dynamic and multifaceted process that extends beyond the initial recovery period. Through a combination of physical, occupational, and speech therapies, as well as ongoing support and adaptive strategies, individuals can navigate the challenges of stroke recovery and work towards reclaiming a fulfilling and meaningful life. While the road to recovery may be demanding, the resilience of individuals, coupled with comprehensive rehabilitation efforts, holds the promise of renewed possibilities and a brighter future.